You've got to remember surveillance actually drives response.
The Health Ministry will start releasing daily COVID-19 infection numbers from today. Now, it comes on the back of a surge in weekly cases. Let's get to the point with infectious diseases expert Professor D Fisher. Prof, what should we make of MOH's decision to release those COVID-19 numbers daily again?
Thanks, Haryanto. As you mentioned, the estimated case numbers have increased. There's a couple of reasons to increase the surveillance to daily reporting. You've got to remember surveillance actually drives response, and there's two responses that we'd be looking for here. One from individuals to help bring this down, and the other one is how the health system can respond, because we know what happens if we get overwhelmed there.
Professor, given that COVID-19 is now endemic and we are living with the virus, how much attention should we give to these numbers, and what should we look out for?
Well, it's quite a steep rise over the last couple of weeks, even more than in other waves. So I think the things that individuals can do, it's a reminder to be vaccinated. We know that people that haven't been vaccinated in the last year have got perhaps a double chance of, or almost double chance of severe illness. People might decide to mask up again if they've stopped wearing masks. They might avoid crowded places, just for these sort of 6 weeks, or maybe a little bit more until this surge is over. So there are things people can do to protect themselves and particularly protect those at risk, those more elderly people, those with immune suppressed conditions. In hospitals, we can start to see some impact on elective surgery, for instance. We can have some sort of estimate of what's going to be the impact on intensive care units, because the number of cases are up. We're going to expect that lag to translate into more intensive care unit needs.
You mentioned something about 6 weeks. What are you referring to for that 6 weeks?
Well, I think most of us believe that this will take a bell curve shape. So it'll probably keep going up for another week or two. Then it'll probably plateau out and then start to come back down. So that's a typical time course. You wouldn't expect a wave like this to last, 3-4 months, for instance. But so when we start to see it come back down, we know it's under control. We might ease off on those restrictions that we might impose on ourselves now. And the surveillance will probably go back to weekly reporting.
Professor, should we be concerned about this current COVID-19 surge?
Concerned, but it needs to be proportional. This is a different context to 2020, when everyone was non-immune and to some degree, or to various degrees, very vulnerable. So because most of us have now got immunity through the vaccine, plus or minus having had COVID, we're much less likely to get severe disease. But still, there are deaths happening. There are people going to ICU. So we're concerned on behalf of them, and we need to act accordingly. But also, even if you're going to get mild COVID, everyone knows now that their risk of even mild COVID is greater, and maybe people will choose to do some of those measures before, avoiding the crowds. If you're sick, wear a mask. Maybe work from home or school from home if you've got some sickness, just to help bring this wave under control a bit more quickly.